doctor. My name's Elizabeth. I'm going to be the nurse assessing you today. So first I'm just taking note of her general overall appearance. She appears well kept, dressed appropriately for the environment. I'm noting her skin color, which appears to be consistent throughout and appropriate for her ethnicity, and her general mood and alertness. She's awake, she's alert, and she appears to have a positive mood. So we're going to start with the GI portion. We're going to do a GI musculoskeletal and neurologic assessment today. So I'm just going to have you lay down. And first we're going to start with inspection of the abdomen. So I'm just inspecting for any signs of peristalsis or distension, which I don't see, and there's no discoloration. So then we'll move on to auscultation. So I'm going to do all 4 quadrants. Normally I would listen for 2 to 5 minutes in each quadrant, but for the sake of the video, we won't. We're just going to listen for normal bowel sounds, which would be 5 to 35 a minute. And then we'll go on to the arteries. So I'm going to listen to the aortic. I'm listening for any bruits. And we'll go to the sides. We'll do renal. And inguinal. Okay, and I don't hear any bruits with that. So next we'll go on to percussion. So I'm going to do this in all 4 quadrants, and I just want to note tympany, which I hear. Okay, and then we're going to percuss the liver. So I'm going to go mid-clavicular, and I'm going to start from the bottom, and I want to hear dullness. The span should be within 6 to 12 centimeters, so that's appropriate. And we'll also percuss the liver. So I should hear resonance with the liver. Dullness would be a sign of splenomegaly. So that's appropriate. And then I'm going to move on to palpation. So we'll start with light palpation, noting for any discomfort. Any discomfort here? No. Okay, and then we can move on to deep palpation. And then we'll go on to palpation of the liver. So I'm just going to have you take a deep breath in and exhale. Okay, so I can feel under this lower rib here. And then we'll do the kidney on this side also. So underneath on her back. Okay, for that. And then we'll do the spleen. If I heard dullness, signs of splenomegaly, I wouldn't palpate the spleen. And I don't feel the spleen, which is a normal finding. And we'll do the kidney on this side, which is underneath. Also deep breath, and again, exhale. Okay. And then we're also just going to palpate for this aorta. So I'm noting any pulsations, don't feel a thrill, and this is less than 3 centimeters, which is an appropriate finding. And that concludes the abdominal assessment. Okay, now we'll move on to the shoulders. So I'm inspecting the clavicles, the shoulders, the scapula. I want to make sure it's symmetrical bilaterally. I don't see any signs of winging, which would be a sign of dislocation, or edema, or discoloration. There's no muscle wasting. And then I'll palpate the clavicle, the sternoclavicular joint, the AC joint, the acromion process. I could palpate the scapula. I don't feel any crepitus or swelling. Do you have any tenderness with this? No. Okay, great. That's a normal finding. So then we'll go to range of motion of the head and neck. So I'm just going to ask you to flex your neck, chin down to your chest. So that should be 45 degrees, which is normal. And then you can extend. So you're going to lift your head up and back, also 45 degrees. We'll do lateral bend. So ear to your shoulder, 40 degrees. Ear to your other shoulder, 40 degrees. That's normal. And then we're going to do rotation. So chin over your shoulder, and then the other side also. So that's 70 degrees, which is normal. And then we'll check the strength of your neck. So just push against my hands, and then the other side. Great. And then we'll move to your shoulders. So if you can put your arms up for extension, and then so that should be 180 degrees, which is normal. And then you can bend them back this way. That's 90 degrees, and then back this way also 90 degrees. And then we'll do across abduction. So that's 50 degrees, which is normal. And then we'll check the strength of your shoulders. So if you could just shrug. So that's, again, 5 out of 5 strength. There's no fatigue with that. And then move on to your elbows. So if you can extend your elbows and then flex them up. So that's 160 and then 180 degrees. And then we'll do supine, which is 90 degrees, and then prone, which is 90 degrees. And then we'll check the strength of the elbows. So I'm just gonna have you pull and then push against me. And then those are both 5 out of 5 strength, which is normal. Okay, so now we're gonna do an assessment of the reflexes. So I'm gonna start with your bicep reflex. I'm just gonna have you relax your arm. I'm gonna put my thumb over here, and I'm assessing for contraction of the bicep and the elbow, and that's a 2+ grading. And then we're gonna move on to the brachioradialis. So I'm just assessing for flexion and supination of the arm, which is normal, and 2+ grading, also normal. And then the tricep. So I'm going to assess for extension of the arm and contraction of the tricep muscle, and a 2+ grading there as well. And then I would do the same thing on the other side to assess if that's even bilaterally. And I'm going to check my pulses while I'm here. I have my brachial and my radial, and I'm inspecting the hands and the wrist. They're symmetrical bilaterally. I'm assessing for any joint deformity. Do you have any pain or tenderness? I don't see any edema. I have all 10 fingers here and intact. And then I'm just inspecting range of motion in the hands now. So I'm just going to have you flex your arms up, and then we're going to, flex your arms down. This is 90 degrees, and then extend them up. This is 70 degrees. And then we're going to do radial deviation, and then ulnar deviation, side to side. And then you're just going to keep your arm spot here, and you're going to push it against me first there, and then push against me as well. And that's 5+ strength. And then you're going to just squeeze my fingers, and again, 5+ strength. Okay, now we're moving on to assessment of the hips. So I have my patient laying down. I'm palpating the anterior and the posterior structures. I'm palpating the ACES for signs of an avulsion fracture, which I don't feel. I don't feel any crepitus of the hips. Do you have any pain or tenderness? I don't feel any swelling or edema. So then I'm going to do range of motion of the hips. So I'm going to have my patient extend the legs up. So this is 90 degrees, which is normal. And then I'm just going to go knee to chest, and that should be 130 to 150 degrees. And then I'm going to hold this ankle, rotate internally. This is 35 to 40 degrees, that's normal. And then externally, that's 40 to 50 degrees, which is normal. And then we're going to extend the leg and adduction, which is 20 to 30 degrees, and then abduction, which is 40 degrees. And then I'm just going to ask my patient to roll over onto her stomach. That way we can assess extension of the legs. So we're going to go up. This is extension, that's 30 degrees, both sides, and I want to assess this on both sides bilaterally to make sure that it was symmetrical. Okay, so moving on to assessment of the lower extremities. First, I would have the patient in a gown, and I would be assessing the skin. I'd be inspecting for any edema, ecchymosis, impaired skin integrity. And then I'll move on to palpation. So I'm going to palpate the femur. This feels smooth. I don't feel any masses. I'll do the patella. This is smooth but firm. And then the tibia, smooth, no masses. I don't know any swelling. Do you have any tenderness? No. And then I'll palpate distally. There's the fibula. Do you have any tenderness? No. And then I'm going to palpate the talus, and the medial and the lateral malleolus. Any tenderness? I don't feel any masses or inappropriate indentations or edema. Then I'll palpate the pedal pulses. These are 2+ bilaterally. And then do you have any tenderness on your feet? And then we'll go to range of motion of the foot. So we'll assess for dorsiflexion. So first that would be up, so that should be 20 degrees normally, and then plantar flexion down, and that should be 45 degrees. If you could press against my hand, like a pedal, a gas pedal. And then I'm assessing the ankle joint for any increased laxity, which would indicate a ligament injury. And then we will do inversion and eversion of the foot. And are you able to flex your toes for me? Great. And then I'm just going to move first I'm going to have you do extension of your legs. If you could bring your legs up. Great, thank you. And I'm going to put you in a supine position. That way I can assess knee flexion. If you could bring your knees up to your chest. Great, thank you. And I don't assess any clicking, popping, or inappropriate sounds when assessing the knees. Okay, so now we're going to go into assessment of the spine. So first I would just inspect the back. I'm looking for any kyphosis, lordosis, scoliosis, or a pelvic tilt. I'm going to ask my patient if she can lean forward. This is flexion. We're assessing for a 90-degree angle. I'm assessing that the spine is midline. Do you have any pain or tenderness?
No.
Okay, and then I don't feel any masses. I don't feel any spinal deviation. And I'm going to have you stand upright again, and you can actually lean back, extend. This is extension with your back, not with your neck. And then I'm going to just ask you to reach over to your right for flexion. So that should be 35 degrees. And then again on the other side, 35 degrees, and then extension backward. That was 30 degrees, so that's an appropriate finding. Okay, now we're going to assess the cranial nerves. So first I'm going to assess cranial nerve 1, which is the olfactory nerve. I'm just going to have you close your eyes, and you can tell me what you smell.
Lemon.
Okay, great. So cranial nerve 1 is intact. And then we're going to move on to cranial nerve 2. So that's the optic. And I'm just going to have you cover one eye and just tell me, we're going to assess the visual fields, what numbers you can see.
2, 1, 3.
And then cover the other eye.
1, 2, 3.
Great. And then we're going to go to cranial nerves 3, 4, and 6. So first we're going to assess the extraocular movement. So I'm just going to have you follow my finger just with your eyes, not with your head. And then convergence. And then we're going to check for perla. So I'm just going to have you look straight forward, just look right at me. And I'm going to check that the pupils are equal, round, reactive to light on both sides. And then if you could just blink for me. Great, so cranial nerves 3, 4, and 6 are intact. And then we'll go to facial sensation. So that's cranial nerve 5. So I'm just going to ask you to close your eyes. And then on your face, I'm going to touch you with either the soft or the sharp side of the tongue depressor, and just tell me which side it is.
Dull.
Great. And then also for facial, I'm just going to assess the masseter and the temporal muscle. So I'm just going to ask you to clench down, and I'm assessing for the strength of both the masseter and the temporal muscles. And then I'm going to assess facial movement. That's cranial nerve 7. So I'm just going to ask you to smile and frown and puff out your cheeks. Great. And then for cranial nerve 8, we're assessing hearing. So I'm just going to have you turn, and I'm going to whisper 1, 2, 3.
1, 2, 3.
And the other side,
A, B, C.
great. And then for cranial nerves 9 and 10, I'm going to assess for first palatal movement. So if you could say and then swallow. And then for cranial nerve 11, we're going to do the trapezius and the sternocleidomastoid. So if you can, first I'm just going to have you push against resistance here, and again on this side, and then shrug your shoulders. Great, so those are intact. And then for cranial nerve 12, I'm going to have you stick out your tongue. If you could stick out your tongue. And then I'm going to assess strength on either side. Okay, so cranial nerve 12 is intact. Okay, so moving on to our seated neuro exam. First, I'm just going to ask my patient if she can, she's going to hit her legs with her palms and then the backs of her hands rapidly, and I'm just noting that she can do that with ease. And then I'm going to ask you to drag your heel on your shin, and I'm noting the rate and rhythm that she's able to do this smoothly. And then I'm going to ask you to close your eyes for the next several exams. So I'm going to assess superficially for superficial pain. So I'm going to go up a dermatomal distribution, and I'm just going to ask you to tell me if what you're feeling is dull or sharp.
Dull. Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay, great. So that was appropriate. And then we're going to go to temperature. So we're going to, I have a bottle of warm water and cold water. My patient's eyes are still closed. And I'm going to, again, go through a dermatomal distribution and just ask her to indicate which one is warm and which one is cold.
Warm. cold, warm, cold, warm, cold, warm, cold.
Great. And then we're going to go to vibratory sensation. So I'm just going to ask, I'm going to have her stick out her hand, and I'm going to, on a bony prominence, can you feel the sensation?
Yes.
And on the other side?
Yes.
Okay. And I'm just going to have you keep your hands out like that, and I'm going to take one of your fingers, and if you can just tell me if it's up or down.
Up, down.
Great. So proprioception is intact appropriately. And then for the cortical sensation, I'm just going to put an object in your hands, and I'm just going to ask you to tell me what it is.
A pencil.
Great. So sterignosis is intact, and then I'm going to draw something in your hand. If you could just tell me what it is.
3.
Great. And the other hand.
3.
So that's graphesthesia. That's intact appropriately. And then I'm going to take 2 sharp objects, and I'm just going to ask you to indicate, can you feel 2 different points?
Yes.
And you still feel 2 different points?
Yes.
And let me know when you can no longer feel 2 different points.
Now.
Okay, so that's appropriate. We'll try again on the other side. You feel 2 different points?
Yes.
Okay, and let me know when you can no longer distinguish 2 different points.
Now.
Okay, so that's a very small level of distinction she's able to discriminate. And then we will go to distinction. So I'm just going to touch you on 2 different sides of your body, and you can just let me know where I'm touching you.
Both wrists.
Okay, and am I still touching you on both wrists?
No, just the left.
Just the left. Okay, great. And that concludes the seated neuro assessment. All right, so now for the standing neuro exam, Alondra, I'm just going to ask you, I'm observing her standing. I'm going to ask you to walk forward in a straight line. I'm going to ask you to walk on your heels. I'm going to ask you to walk on your toes also. And I'm going to ask you to walk heel to toe. And I'm assessing for balance, coordination, any stiffness, any signs of cerebellar disease. I don't see any fatigue, and she seems well coordinated. Then I'm going to do the Romberg sign, so I'm just going to ask you to stand with your feet together. First, keep your eyes open, and then I'm going to ask you to close your eyes, and I'm just observing for any swaying. I'm able to see that she's able to keep her balance, which is an appropriate finding. Then we're going to test for pronator drift. So now I'm just going to ask you if you can just extend your arms out with your palms up. And I'm just assessing for any downward drift of an arm, which would indicate a stroke, which I don't see, and that's an appropriate finding. And that concludes my neuro assessment.